taking seriously everything we know about chronic illness in America, which is devastating and endemic, and taking seriously that cancers are rising among young people, taking seriously that there are unusual forms of pollution all around us, including microplastics, which we don't really understand what they do to the human body. I have to think that MAHA is like the wrong answer to the right question. How would you think about beginning to formulate the right answer to that question, rather than just counter-polarizing, into a defense of the institutions or policies as they exist?
I think that there are a few different things. So I think to hammer home about entitlements again, first, I think you could do Medicare for all who want it, right? If you're not going to be able to do Medicare for all, you could do Medicare for all who want it, and you could expand healthcare access in this country. You could do more generous entitlements rather than less. That would go a huge distance, right? Chronic disease in this country is a colossal issue. It is not borne equally amongst classes. People who are poorer have a much greater disease burden. You could do things that RFK Jr. himself said he wanted to do, which is invest in both on the research side, trying to understand the role of some of these contaminants in human health. We have questions about chemical additives. There are lots of things we actually don't understand that well that we could use a lot more research on. And he could invest in that. You could totally change the way that you pay for healthcare in this country. And this is something that they sort of maybe are doing. They are looking at reimbursement schemes so that right now we relatively over-reimburse procedures versus talking, right? You get paid much, much more to go do a colonoscopy than you do to go talk to your primary care doctor for the same amount of time. Or the doctors get paid much more. And it incentivizes certain types of care being used more often than others. And it also just makes it very hard to meet the demand for certain types of care. So we make it easier to prescribe antidepressants than it is to find a therapist who can see you and who can be paid for that time. You could totally change the way that you think about reimbursing all of these non-pharmacologic interventions in ways that would incentivize their use. There's lots of good evidence for doing that. We don't do that right now in the system. And then, I think the question about how to manage this breakdown in trust is also really interesting. I think it's critical that we don't counterpolarize. I think we're really in danger of doing that, and we have to be very, very careful about it. I don't think that on any level Democrats want to be the party that's defending pharma, right? Like that's a huge, huge trap for us.
I'm curious what you'd add to that.
Well, I think one really important thing is that, RFK is really driving liberals away from public health guidance too, and that's quite damaging. The repopulation of his vaccine advisory panel, I don't think many liberals are going to trust the advice of that panel going forward. I think that is quite damaging. I think the changes to the vaccine compensation program he proposes are, quite problematic. But I would sort of emphasize your point, which is that, on a lot of these questions, why are Americans less healthy? We don't know all of the answers in total detail, but we know the broad strokes. We know that we're a more violent society. We know that we have, more guns. We know that we drink and do drugs more. We know that our diets are unhealthy. We know that we don't exercise enough. These are not questions that we don't know the answers to. The problem is, how do we manage to encourage good behavior, discourage bad behavior, and support it through funding and public policy? And I don't know that the answers there are obvious, and I don't know how much progress even an ideal figure in RFK's position would have, because we are so, in all of these areas, fighting against one another, animated by resentment towards elites and institutions, trying to navigate and find new ways around old guidance towards new wisdom. It just feels to me like, we're in a bit of a free-for-all brawl, and that we are in a phase when we're going to be repolarizing and repolarizing and repolarizing.
The MAHA movement is bringing us back to healthy foods that come directly from nature and not processed foods that have gone through so many steps to get to our table.
Jo is a Democrat. She lives in New Jersey.
It's not a political issue. It's an issue of, do you want your kids to get the best food or not? Do you want your kid to have the best environment to live in.
Kennedy has pledged to address America's chronic diseases, poor diets, and environmental toxins. But as recently as 2023, he repeated a debunked claim, saying, quote, "I do believe that autism does come from vaccines. Multiple studies have shown there is no link between vaccines and autism." Like Cho, Teresa Warner is also a MAHA mother of 3 who's conscientious about the food she serves her family. She too supports Kennedy. That's her in the middle, but she's a Republican. What is it about RFK Jr. that resonates most with you?
I think one of the things is certainly his attention to this culture of chronic disease and the chronic disease epidemic that's happening to our kids. And the other thing is upholding our parental rights and freedoms, which is so important.
Warner did not have her kids vaccinated. Cho did. But both agree parents should have the right to decide. The American Academy of Pediatrics says vaccines are safe and effective.
So many of the moms that support Bobby may not agree on everything, but what I do know that as MAHA moms we can agree on is that he wants to see our kids healthier.
So at a news conference today, leaders of the MAHA movement said while they see today as a real victory, they hope that Kennedy will use his power and use his position to highlight issues they think the government has insufficiently studied in the past, things like food additives and vaccine safety. They also said they're going to be pushing legislation and keeping track of which members of Congress actually support that legislation.
Okay, Elaine Quijano, thanks so much.
Here's what Robert F. Kennedy Jr.'s Make America Healthy Again report cites as what they see as the key potential drivers of chronic disease in kids. Number 1 is a poor diet with too many ultra-processed foods. Number 2, chemicals in the air, food, and water, like pesticides and microplastics. 3 is too much screen time and a lack of physical activity. And 4 is overuse of certain drugs, like those for ADHD, antidepressants, and antibiotics. Now, people in the public health world agree with some of this and are concerned about some of it. On the parts they agree on, ultra-processed foods, a lot of folks think that those need more scrutiny. What they're worried about is that the report mentions the childhood vaccination schedule, which pediatricians say has been proven to be safe and beneficial for kids. RFK Jr., of course, has a history of sowing doubt about the safety of vaccines. And the report also doesn't address gun-related deaths, which public health groups say are a leading cause of death among kids in the United States. They're also getting pushback from industry, especially agriculture, which is concerned about the report's focus on pesticides. Now, the next step here is a laying out of the strategy to address these issues. That is expected sometime in August.
Under socialism, everyone lives in poverty. Is that why 25,000 people pass away from starvation every day? Under capitalism? Socialist healthcare, you have to be on wait lists for months or you may not get treated. You mean currently under capitalism? Because that's what we have to deal with currently under capitalism. Also, if socialized healthcare is so bad, why is it that every country that has socialized healthcare has better health outcomes than Americans do? If this system was so awesome, then everybody would be healthy and we'd have the best outcomes in the world. But we don't. Because all of our necessities in life are put behind a paywall, therefore making them a luxury. Like, it's such a strange position to have where you think this system, capitalism, is the best system of all time, yet over and over and over again, socialist nations do better in almost every single category than America does. So please explain to me how this system's the best, where children can pass away because their parents are too poor to afford health care, and that's better than a system that doesn't allow that. Tell me how this system that allows for children to be in school lunch debt is better than countries that don't put children in school lunch debt, give them free food, and give them super healthy food. Tell me why that's worse than what we currently have, where kids go hungry, again, because their parents are too poor. And they're not poor because they're not working. They're poor because they do work constantly, but every single job doesn't pay enough for them to take care of their family. And we've built an entire society around paying people less than what's necessary for just the bare necessities. Just the basic necessities, not luxuries. Just the bare minimum is too much to ask for our current economic system. But yeah, socialism's evil. Grow up.
You know, like, I know that RFK Jr. has no business running the health industry. Any man that carries the head of a whale on top of his vehicle is not right in my book, period. But to find out that his Make America Healthy Again ideas are made up, it's just, like, he falsified scientific documents. 3 particular authors that he swore wrote the articles on ADHD, childhood anxiety, as well as asthma in children. were not the authors. They have come forward and said, we had no part in any of those articles. Our name should not be listed on any of these. Our team and I did not write these. We do not support these. This is not the facts. And this is the man in charge of our health. Like, he is falsifying documents. And then when Carolyn Levitt is asked about the fact that these are not written by these particular scientists, she wrote, well, it's just formatting issues. You put someone's name on a scientific article to try and convince the American people to understand science from this perspective, and we find out those are lies and they weren't even written by that person. You have no business being in that position. You should be fired, period.
What's up, amazing people? So guys, in today's video, it's very interesting one because it's dealing with health, and that is about health issues concerning the American people. So I have a genuine question that I want to ask you. I mean, when was the last time that you felt like the American healthcare system was actually designed to keep you healthy as an American and not just keep you paying? Yeah, exactly. So now I want you to understand why this conversation really matters, because quietly but very deliberately something new is taking shape in American politics, and that is MAHA, Make America Healthy Again, MAHA. And yeah, this is not just a slogan, by the way, it's a pushback. Yeah, a rebellion, a health revolution that is starting to rattle the same politician or the same political and corporate forces that have been comfortable for decades. Here is the thing that the mainstream media does not want you to say it loudly or come out in the public spaces and talk about it. America, as a government, spends more on healthcare than any other country on earth. Did you know that? Yet Americans are sicker each and every day. Chronic illness are up. They are very high. Childhood diseases are up. Mental health is collapsing. Food is more processed. By the way, I was told in America that it's very rare to get raw food, especially from the farm. Almost everything is processed, and you all know that processed foods are unhealthy. So medicine is more expensive again, and somehow the solution is always more pills and more pills, more shots, more subscriptions to sickness. I mean, terrible. Now that is where MAHA began. MAHA is not saying don't trust doctors. MAHA isn't saying ignore science. No, it's not telling you either of those. What is it saying, or what it actually means, is that who controls science? Who profits from the sickness? And why are everyday Americans never part of that conversation, by the way? Very good question. The movement is tied closely to the broader America First mindset, if you may have noticed, because at the end of the day, health, just like borders or jobs, is about sovereignty. If a nation cannot feed its people real and raw food from the farms, if a nation cannot protect its children or question powerful pharmaceutical interests, then who is really in charge? Who? Have you ever asked yourself that question? And have you ever noticed who is getting more nervous in this conversation? Of course, the big pharmaceutical companies. But MAHA isn't nervous at all. Corporate food giants, they don't like MAHA. Did you know that? Big pharmaceutical companies, they don't like MAHA. Did you know that? Career politicians funded by health lobbyists definitely don't like MAHA. Make America healthy again. Why do you think that all this category of people don't like MAHA? That is because MAHA threatens a system where illness is a business model. We are going to talk about questioning chemicals in the food that are probably banned in America, and we are going to talk about the transparency in vaccines and medication. We will talk about preventive health instead of reactive treatment. We will talk about parents having a voice again. Suddenly, the same people who shout, "My body, my choice," they get very uncomfortable when Americans start asking questions, unfortunately. And this is where America politics gets very interesting, because MAHA is not left wing or right wing, and its main purpose is one simple thing: anti-corruption. But let's be honest, MAHA is finding more oxygen on the conservative side. Did you know that? Especially among the voters who already distrust the big government, the big corporation, and unelected experts making decisions behind closed doors. You can feel that environment in town halls, you can see it in campaign speeches, you can hear the parents and the veterans and working class Americans saying that something is wrong and we are done pretending. So this is why MAGA is not just about health, it's about control, about trust, and about whether America chooses people over profits. And just like any other movement that threatens the status quo, it's being mocked, minimized, and misrepresented. But history tells us something very important. When the system gets loud, it's usually because it feels threatened. Our question today is not whether MAHA will change the conversation, because the conversation has already changed. The real question is whether Americans are ready to demand a healthcare system that actually rewards health and not sickness. Because if Make America Healthy Again really takes off, it won't just be a health revolution, it will be a political one. Thank you guys if you watched this video up to this point. I appreciate your presence. I'll see you in the next one. Bye.